Ever pondered on the mystery of the human orgasm? In particular, have you previously thought about what separates the male orgasm from the female one? It's a riveting subject, embedded in both biology and psychology, and provides an exciting exploration of human sexuality. So let's prepare as we delve into the complex yet intriguing domain of orgasms, progressively unraveling the discrepancies between male and female climaxes. In the vast spectrum of human experiences, orgasms can be considered the zenith of sensual pleasure. They're an intricate amalgamation of physical sensation and psychological satisfaction, a sensory experience unlike any other. An orgasm is not simply a physical occurrence, but a multi-layered phenomenon that encompasses every aspect of our being: physical, mental, and but what exactly does happen in the body during an orgasm? It all starts with sexual arousal, an initial trigger that sets off a series of responses in the body. During this phase, blood flow increases to the genital area. This heightened blood flow is responsible for causing the sexual organs to swell, preparing the body for the impending orgasm. In men, this blood rush leads to an erection, a physical sign of arousal that's quite obvious. This swelling is a critical part of the male sexual response and plays a crucial role in the process of ejaculation. In women, on the other hand, the clitoris and the walls of the vagina become engorged. This swelling increases sensitivity in these regions, enhancing the potential for pleasure. The brain, often referred to as the most significant sexual organ, also plays an essential role in the orgasmic process. It orchestrates the entire experience, controlling the release of specific chemicals and hormones that drive sexual desire and pleasure. As the pleasure builds, the brain releases a cocktail of chemicals, including dopamine and oxytocin. Dopamine, often called the feel-good hormone, is associated with feelings of happiness and pleasure. Oxytocin, on the other hand, is often referred to as the love hormone. It's related to feelings of closeness and bonding. They work in synchronization, creating a euphoric sensation that's often described as blissful or even transcendental. When an individual reaches the point of orgasm, these chemicals flood the body in a wave of intense sensation. This flooding leads to the intense feelings associated with climax, creating a sense of satisfaction and euphoria that's hard to compare to any other human experience. It's a moment of pure bliss, a peak of pleasure that's as mysterious as it is enjoyable. When an individual reaches the point of orgasm, these chemicals flood the body, leading to the intense feelings associated with climax. However, despite these shared aspects, male and female orgasms are not identical. They are unique phenomena that, although converge in some ways, diverge in many. One of the crystal-clear differences resides in the duration. On average, a male orgasm lasts approximately 6 seconds, succinct yet potent. On the flip side, a female orgasm can extend upwards of 20 seconds, a roller coaster of sensation that reaches far beyond the brevity of the male equivalent. This disparity is primarily due to the physiological differences in our biological makeup. Another striking divergence between the two is the refractory period. This is the recovery phase post-orgasm, wherein it becomes challenging, even impossible, to be aroused again. In males, this period can stretch from mere minutes to hours, or expand to days in certain cases. This indicates the stark difference in sexual recovery mechanisms across genders. Females, in contrast, do not usually experience a refractory period, offering them the potential for multiple orgasms, a significant difference indeed. The location of pleasure also varies significantly. Men often experience pleasure primarily in the penis, a concentrated area of sensual response. In contrast, women can experience pleasure in a variety of locations, a sensory palette that includes but is not limited to the clitoris, the vagina, and the uterus. These diverse routes to pleasure underscore the complexity and richness of female sexual response. It's crucial to point out that the orgasm is not just about physical pleasure. It carries several health benefits too. For instance, it can relieve stress, a natural antidote to the pressures of modern living. It can also improve sleep, serving as a natural sedative that fosters a healthier sleep cycle. Furthermore, it can boost the immune system, fortifying our bodies against disease. Remarkably, it can even alleviate pain, acting as a natural analgesic that can soothe various discomforts. To summarize, the male and female orgasms share some similarities, such as the increase in blood flow to the genital region and the release of pleasure-inducing chemicals from the brain. Yet, they are distinguished by their duration, the refractory period, and the diverse locations of pleasure. Remember, Comprehending one's body and its responses to sexual stimulation is essential for a satisfying sexual experience. So, whether you're a man or a woman, embracing and understanding your orgasms can lead to increased sexual satisfaction. And who wouldn't want that?